Hi, I am Adam Pearson, and I am a licensed mental health provider. I'm a LPC, LCPC, LMHC, CMHC. They're all pretty much the same. A master's level provider, and I'm licensed in 9 states. But I focus now on providing mental health evaluations for veterans, and so for their for your claims that you seek out from the VA. And I have found in the last 2 years that, which I learned, but I got very detailed. The Veterans Administration, when veterans seek out mental health benefits, they make it, and it depends where you go. They try to deny them. The it's They're called educators. Educators are So let me back up. So a veteran, let's say John, he has PTSD or depression or a multitude of diagnoses, symptoms, and he goes in and he submits a claim. Well, uh, and let me add, the more mental health history, including current or past medications, records, everything helps build, just like in a court of law, that's evidence of your claim. And so, a mental health evaluation, which includes a clinical interview, diagnosing the symptoms, assessments. Assessments are equivalent to like an x ray for a broken bone. They are stronger in a court of law, which sometimes these end up in more than my clinical interview. So I give a clinical interview to every new patient or client, and I observe, but that's subjective and it's strong, but not as strong as assessment. Assessments are objective, factual, proven. So I give tests or assessments for depression or generalized anxiety disorder, PTSD, alcohol use disorder, which is alcohol addiction. And so when a veteran submits it to the VA, you'll typically see a psychiatrist or a psychologist, and you bring all the records and evidence, and they are required by law to review all records. Doesn't mean they do, but they are required to. Then after that, it goes to an educator. An educator is someone maybe with a bachelor's degree, no medical training, and they will approve or deny your claim. After the claim is approved, then you get your benefits depending on the rating. There's a 10%, 30%, 50%, 70%, and 100% rating. I have not ever wrote a mental health evaluation for a veteran who does not qualify for a 70% claim. A 70% claim typically automatically is given for a veteran who has been having uh, long-term passive suicidal ideation. That would be where you just wish you could die and go to heaven. It'd be easier if I wasn't here. That also includes active suicide, where you've thought of how, when, where you've had motivation, desire, suicide attempts. That's typically 70%. 100% rating in mental health is rarely ever going to be given because the people that would qualify for those are honestly in institutions long term. They are psychotic they are homicidal and suicidal most of the time. And this is all from my research and practicing for veterans. Now, the reason I focus on veterans only now is because my heart really is for that. My dad was a veteran, and um, there are many companies out there that say they care about you. Some are veteran owned, but there are a lot of them that, and there's been a couple. Well, there's been two or three I've seen. I will say the average they make, which anyone can submit a claim to the VA, and I guide some, but I'll point veterans after I write a mental health eval to people that I know that are actually fighting for them versus there's companies or just individuals. They will make $12,500 average off the benefits that you get, and submitting a claim is not that complicated. And I explain that. But when I write a mental health evaluation, I am to be objective, which I am. And there's, veterans come, and I have never seen a veteran with a just one diagnosis. It's usually 3 to 5. And the diagnoses are important. It's the symptoms which I document, and I write to how the VA, it's very important to the VA, the government at the end of the day, how it's documented. And so there's actually language from the 1800s that you will see in a claim. I can't think of it now, but it says it's basically, I testify that veteran, let's say Quigley, it is more likely than not that he has major depressive disorder because of his service in the Army, and that's just an example. And there's a fancy word, and I just can't think of it now. But I've got this fine-tuned to an art form. And so the good thing is I can provide, and I do provide, mental health evaluations for veterans in all 50 states because it's federal. Now, this isn't therapy. An evaluation is not therapy. If I was providing therapy, that's different. That's where, yes, I'm licensed in the United States, but that's different. A mental health evaluation. And when this happened, the VA tried to fight that veterans have to be evaluated by a provider in their state where they reside. Well, the VA lost because veterans and people who fought for them, probably attorneys, stated that, veterans were all over the country, all over the world, therefore, and it is federal. And so, and that's one reason I'm throwing this out. I'm very transparent. I will, in mental health, there's malingering. Malingering is basically lying. Most 99.9% of veterans are not going to have to malinger or lie about their conditions. You just be honest, because I have not met a veteran that has not been traumatized while they're serving. It goes from even going into boot camp. That is traumatizing. There's verbal abuse, mental abuse, emotional abuse. There is the loss of your friends, the constant danger, all these things, and alcohol addictions or other addictions form from the service, which PTSD, depression, anxiety, and there's also somatic or somatoform disorder, somatic disorder, which is pain. So if you have chronic pain, which can be from your physical injuries, because physical and mental are always going to go together. And let me inform you, if you're a veteran, if you have physical injuries that you sustained while in service, that's a different claim. So you have the physical claim and then a mental health claim. Now, I can't do the physical claim, but the physical, so let's say you broke your leg or injured it and it's permanent. Well, that's going to cause depression. That's going to cause anxiety. And the claims are based upon, and the degree of how much you get paid is based upon the decrease in functioning in your social, personal, and occupational areas of your life since being in the military or due to your service. And so, and I am very clear and transparent. I charge a flat $500 because it takes, honestly, around 6 to 8 hours. But I get them cranked out within a week, and you have it ready to submit. And that's all evidence. Everything from my evaluation to the assessments I give you. And I always encourage veterans, submit your assessments. Your assessments are like x-rays, they're like an MRI. And that's like going to a court of law. So VA, if they deny your claim, when you have a mental health provider providing diagnoses, symptoms, and because if they deny that, that's fraudulent. That is a federal crime. And so that's when you can challenge that and go to court. And so, but here, I forgot, I'm sorry, on the educators. So these educators, let's say you've turned in your mental health claim, and a psychiatrist or psychologist, a colleague of mine, reviews it, gives their recommendations. The educator is just someone hardly any medical training whatsoever. Not nearly they cannot diagnose, they cannot treat mental health disorders like me or any provider, and they actually get bonuses based upon how many claims they deny, or they get in trouble if they approve too many. And I have met a couple gentlemen that have quit the VA that were educators that I point veterans to. And I help the veterans because I care. Now, when I write and do the clinical interview, I am very objective, but there's no trying. And it's and I will tell you, to be successful is to be honest. And we get your stressors, how they're affecting you, and the more you tell me, the more I integrate and guide you. And then I've done my job and I point you. And it's really not, it's people, when you see lawyers and you see these ads about people, companies they want to help you get your mental health evaluation or your mental health claim or your physical claim. Well, that's because they get a pretty good chunk of money when you're approved. And they make you, so after you get your valuation, they're going to take a chunk out of every month of your benefits. And I will say the typical average is $2,500 a month, give or take. And that's just insane to me, to take 10 grand or $12,000 out of your money. All they do is help you submit the claim, and they teach you how to, because you have to go before a VA psychiatrist or psychologist. And it depends, it's a toss of the coin if they care or not, because the VA is also on them on how they are going to ask you leading questions to try to say, are you sure you had depression because of the did anything happen before the military that could have caused this depression? They give you, and so and you can Google most of this, and I educate patients on this, and I don't give a flying crap what anyone thinks, because it is well within my scope, and that's just common knowledge. The government, the VA, does not want to pay you. They don't want to pay anybody, but and that's what I do. I'm straightforward. I always send treatment recommendations, and I always there's 2 breakthrough treatments on more of a cure for PTSD, depression, chronic pain, anxiety. I give all that, and $500 sounds like a lot, but most mental health providers like me, we charge $75 to $150 an hour. I spend about 6 to 8 hours on an evaluation, so I'm really cutting myself short. As you can look, that's why I love, when the truth is the truth, it's always the truth. And so you can go and look, and most other equivalents of mine are charging around $1,000. That's the average. I charge $500 because I wanted to make it affordable, but I don't cheat myself either, because I work my tail off. And I've written many evaluations, and I've never found anyone that malingers or lies. And my advice, never don't minimize your symptoms, but don't maximize them. So anyway, I just wanted to give an introduction. So I'm Adam Pearson. You can contact me, Adam Dale, DALE 1977 at gmail.com. You can message me on here. I'm on Psychology Today, Adam Pearson, You can just Google Adam Pearson Psychology Today. You'll find my profile. Contact me through there. I hope this helps. I will try to add more videos, but I wanted to get to the point. When you go for mental health, if you go for a mental health claim with the VA and do not have any evidence, evaluations, therapy, if you went to a therapist and you don't have their notes, you want to have everything and anything you can, because I try to make it near impossible, if not impossible, for them to deny your claim, because you could not, because then it's fraudulent. And I will say, and I will end with this: insurance companies, if they deny an insurance claim, I'm talking Blue Cross, Medicaid, Medicare, if they deny a claim and it's true, it's fraud. Fraud goes both ways. So some people submit an insurance claim to, say, Blue Cross, that they're injured and they're really not injured. Well, that's fraud. It's a two-way street. So if an insurance company denies a claim, that's fraud. You could take them to court and sue them. So I'm just showing you, and I hope this helps. And so I will fight for you. I've done this. I practiced 14 years. I went for 2 doctorates. I was trained by a psychiatrist who is also an attorney, and that comes in very, very handy in this. I was trained by a psychiatrist who was an attorney for 2 years post-grad. So I am very versed, and I was a patient. I had PTSD, I had depression, I had anxiety, and I'm on the other side and I'm healed. So anyway, there it is. I don't care what anyone thinks. I don't, bad or good. If anyone praises me, that's great. All I want is for you to get what you served, and I'm here to serve. I am blunt with kindness. I will tell you my advice, what I suggest, recommend, and what you do is up to you. But I've got this pretty nail tight. Most of my evaluations, there's been patients or clients, I should say clients. It's either one. But I've wrote my evaluations. The VA has approved them. They didn't have to see the VA psychiatrist or psychologist. They approved it based upon, because mine's airtight, and that's the key. And I write as if I'm going to a court of law. And so, once again, my goal is to serve you, make it near impossible for them to deny your claim, and then get you some support, some relief, some healing. And I support you. I will care for you from step 1 to the end. And there's no catch with me, because I've been there. And people are dying. 27 suicides a day in veterans or active military since 2002 or something like that. And I'm here to help stop that, and for you all to be blessed. And that's it. So thank you for your time. Please contact me. You don't have to subscribe. You don't have to like this video. I could care less. I just want to help you. I will see, and by the way, I see all patients online. That's perfectly fine. We'll get your assessments. I do it through telephone, video. I use everything, and I help you, and I lead you to people that you can use to help you get your claim. Or I advise you, because it's really not hard. You just submit it, and I'll give you some advice, and you can watch YouTube videos on how to handle the VA psychiatrist or psychologist interview. But it's pretty common sense. You just be honest, and you just stick to the evaluation, to the evidence, and you don't give them more than they want. Yes, no, this happened and this happened. This is how it's affecting me. And you just speak the truth, and most of the time you're going to get approved. Every now and then you might have to appeal, but eventually they get sick of you fighting. It's like a nagging. They're going to eventually approve, because you can also sue them if they eventually do not approve, because an evaluation, assessments in a court of law, especially those assessments, I am telling you, and assessments take usually 5 to 10 minutes to take. Those assessments in a court of law are objective. That's like fighting an X-ray in a court of law. You can't. The VA can get in a lot of trouble. And I hope this helped. This was just an intro. This was kind of an overview, but am I giving a what advertisement, a commercial for what I can do for you? Yeah, but I know what I'm doing. I was ranked top 10 out of 1,100 therapists in the nation in 2020. I was featured in a nationwide magazine. I don't say that to brag. I just say that I've been there. I know what I'm doing, and I charge half of what most people in the United States charge for a mental health evaluation. Thank you. Be blessed, and I hope to help you. Goodbye.